Good afternoon. Thanks for having me again. So I didn't quite hear the last bit of your question. The network is a bit weak. Do you mind just repeating the question?
Not at all, Dr. Suliman. Asking for you to please take us through the daily numbers as they stand.
Sure. So at the moment, most of the indicators are showing very promising trends. The leading indicators, that being the number of daily cases being reported, as well as the test positivity rate, has been on a promising trend for the last 2 to 3 weeks now. Also, in addition to that, the good news is that hospitalizations have stabilized, and unfortunately, the number of deaths remain high, but we may see that's just leveling off right now. Hopefully, that will start to decline in the next week or two.
So when you use the phrase hospital admissions have stabilized, what exactly does that mean? What does stability in that regard mean? What does it look like?
So if we look at the number of new admissions across the country over the last week, that has been about 14,500. And that new admissions have been increasing for a number of weeks following the trend that we see in cases. We need to bear in mind that hospitalizations generally lag cases by about 2 weeks. If we go deeper into the numbers, the new hospital admissions have actually declined by about 9 to 10% compared to a week ago. And that's just this past week, which has followed the decline that we saw in cases and test positivity about 2 weeks ago. Looking at the provinces, the Western Cape and the Eastern Cape has been on a sustained decline in terms of the demand for hospital admissions. And we also see that in the other big provinces, KZN and Gauteng, but across many of the other smaller provinces too. So very promising trends in terms of the demand now for hospital admissions. So hopefully the pressure on hospitals and on healthcare workers will start to ease off.
And just looking at your graph there, Dr. Suliman, I noticed that the level 3 hospital admissions that we are experiencing now are almost twice as high as what we'd experienced in level 3. And this is around week 29, week 30, week 29, week 31.
Indeed, that's correct. All of the indicators, in fact, that we've seen over this second wave have been significantly higher than what we saw at the peak of the first wave. The hospital demand, we know, has been much higher in Western Cape, Eastern Cape, KwaZulu-Natal and Gauteng. All of those reported higher number of admissions in this second wave as compared to the peak of the first wave. And that has been expected because we were finding many more confirmed cases in many provinces, the number of cases in the second wave has been almost twice as high as that in the first wave. And so hospital admissions do follow that. I think, though, maybe on a slight good news, though, is that Gauteng was expected to even go to higher levels, and it actually dropped off quicker than expected. So too many of the smaller provinces. So I do think the regulations, restrictions, and public awareness over the last 3 to 4 weeks have actually reduced the impact that we could have seen had we not had those interventions in place.
We did hear the Gauteng Command Council announcing once again today that Gauteng has actually peaked. Is this what is being reflected in the graph there, where you look at the week, 309, that's where literally the peak is, right there at the top, and then exponentially going down at quite a rapid rate?
Indeed. So when we talk about a peak, we refer to the number of new cases being reported. And so if we look nationally, yes, we have reached a peak, and that has been on a sustained decline for the last 2.5 weeks. In fact, it has been decreasing quite quickly, as you say, and that is good news. If we then also look at the provinces, including Gauteng, as you mentioned, all of the provinces are now on a sustained decline, and the number of new cases reported are all decreasing from a peak a couple of weeks ago. The decline is quicker than expected, but I do believe this, as mentioned, has to do with the interventions in place, as well as people being more aware, adhering to regulations. Reduced movement also confirms compliance, and unfortunately also the second wave has probably hit closer to home for many people and many families, and people are being more cautious. And those are probably some of the reasons for the indicators that we see at the moment.
I'd like us for a moment, Dr. Suliman, to look at your deaths chart and explain to us why it's so sporadic. If you're looking at from between week 301, further down, it's really sporadic. There doesn't really seem to be much of a sequence. It's very different to what we're seeing with the hospitalization or even with the cases chart.
Sure. So the number of deaths charted here is the daily reported deaths. Unfortunately, the number of deaths aren't quite reported as timelessly as cases and tests, so those graphs may be a bit smoother, and it's for different reasons. I think there's an auditing process involved, as well as a reporting procedure that may not be as coming through every day, and so we see that in some provinces don't necessarily report every day, and we see a large number then reported after a few days. And so this chart may be a bit more erratic. If we look at the trend, though, shown by the black line, at the moment across the country, we're reporting still over 500 new deaths per day. This number has sort of leveled off perhaps compared to a week ago. So there may be something to look at there, possibly that it's starting to decline. We do expect that the number of deaths should hopefully start declining in the next week or so, following the decline that we saw in cases about 3 to 4 weeks ago.
And how has the testing been, the daily testing for coronavirus? Has that been sustained? I know that was quite vigilant in the early days of COVID-19?
So the number of tests actually over the last week has dropped off a bit. It's down to 48,000 tests per day over the last week, a decrease of about 13% compared to a week ago. Now, just at the beginning of the calendar year and following the festive period, we saw that the number of tests increased impressively up to 75,000 tests a day. And I believe the drop-off of late has been due to a lower demand for testing, just simply because the infection, the rate of transmission has actually been declining. We do need to try and maintain or even increase testing and take advantage of the cheaper antigen-based rapid diagnostic testing going forward. I still believe that this is an important tool that we can use in combating the virus going forward.
And if we look at your daily positivity test, it really does mirror the huge decline that we've been experiencing in the number of cases. Take us through that.
Yeah, so the test positivity measure is probably one of the more important measures to keep track of in South Africa. It's the number of new cases as a percentage of new tests. As you can see from the graph, it's been on a very impressive downward trend for the past 3 weeks. And this firstly does confirm that the decline that we see in the number of cases is real. Secondly, it's also a function of testing. So while testing has actually declined over the last week or so, the test positivity measure has actually actually decrease further. So it should increase with tests decrease, but it's actually decreased over the last 3 weeks, confirming a decrease in the rate of transmission. So while the trend is actually quite promising and impressive, we do need to bear in mind that relative to global standards, currently at 16.8% test positivity, it still is high, and we do need to bring that much lower, firstly below the 10% psychological barrier and also the self-set guideline that we have, and then hopefully below the 5% guideline as set by the World Health Organization. Just to put that figure in context, 3 weeks ago, the test positivity was at a high of about 34%, meaning we were finding a positive test for every 3 tests conducted. And currently at just about 16.5%, we're finding a positive test for every 6 tests conducted. So certainly a significant improvement, and we hope that this trend will continue.
Well, thank you so much, Dr. Suliman. Always great chatting to you and going through the numbers and your very colorful charts there. When you see it and you get a visual reference, always makes it so much easier to both understand and remember that.